what would you say has been happening within, say, your organization, and in terms of understanding the impacts of COVID on the minority communities?
I think there's the emotional impact, which has been very significant. And I have seen the impact on the individuals within the organization, which has been very, very saddening on an individual level, because because of the impact on them and their families, and some of the losses that they have personally suffered, and the regularity of the losses that they've suffered. And that has been a very difficult journey for the staff that I'm very close to, at a time when they've also had this significant commitment to continue working because of the greater good that they want to do. I can't walk in the shoes, but I feel in a position where I have people around me that are willing to share these very emotional experiences with me. And as a leader, that's really important, because it brings it to life, doesn't it, around the impact on the broader well-being of our staff.
Yeah.
I think more generally, we've done a number of things in the CCGs over the last 6 months. We've massively increased our communication and our engagement. So you have an ability to get a sense from staff how they're coping. Within the community, this is a really important element for the CCGs, because, of course, we hold a statutory accountability to reduce health inequalities. And I think what COVID has done, it's really, really brought it to the fore of everybody's consciousness, and really exposed what has been there. So for me, it's gives us a real opportunity to think differently about how we actually engage with that community, in order to truly understand both the impact from a health welfare perspective, but also think very carefully when we're planning around our restoration of services in the next wave, about how do we put greater support into those community. And
within the organization, would you say you are recognizing the racial inequality? And if there is that element of it, what is it that you are doing to try and elevate your BME staff, say, to position of seniority, to position of executive leadership?
So we absolutely know, as an organization, there's much more we need to do around addressing equal opportunities from staff from all communities. One of my executives is from a BAME background, but actually what's pleasing is she's not the only one that's been championing this. So, because it cannot all, as a leadership, it cannot all rest on the person that's from that background. That has to be a collective ownership. And this is important, is how do you as an organisation work within the wider Sussex system, so you have the greatest benefit of doing things in a similar way that's creative enough, that allows a greater progression through health services and health organisations beyond the opportunities even in your own organisation. And there's a programme of work around how we can develop staff more wholly across Sussex. But for me, in the CCGs in my organisation, what we've done is we've refreshed look at our recruitment processes, and I think there's more we need to test ourselves about with that area.
Or how will BME staff or BME communities know that there is the real change? How will it feel to a BME person?
I think actions speak louder than words.
Yeah.
And I think there's been a lot of words historically, and there's been a lot of words since the beginning of the pandemic. The only true way for people to feel the difference is to see the actions that are making the difference. So the area that I'm working through at the moment is how do you get better representation in decision making if you haven't got people in the roles at as much as we need at executive level or at those senior grades. And we're trying to be creative in how we do that. So when we, as an exec management team, as an example, received the system-wide plan to the response to this very important issue, because we have an action plan on that, I invited the chair of the BAME network to come into EMT so that we had some lived experiences.
That environment that allows for a voice to come in once the executive gets the voice from a BME person, that is then going to be deliberated on by those that are within the executive, it definitely would go a long way, actually. Lovely.
You know, I think we need to really drive ourselves towards a better, more representative leadership team and governing body. I mean, I'm really optimistic, but I think it's going to take all of us to keep this at the fore of our mind. I really do. There can be sometimes a lack of confidence to speak up. So how do you give the mechanisms for staff and the community to come forward with their ideas in order to capture them? It's not my job to have all the answers. It's my job to listen to those that have the skills and ability and the desire to develop their actions that will have the biggest impact.
There is quite a lot of introspection as well within your organization, thinking about how you can do things differently, thinking about who you would want to engage, thinking about the impact of the decisions that you are going to be making and who you want to bring along in what you are developing and what you are going to be delivering.